Hello everyone, I'm Hildah Essendi from Triggerize, and I'll just very briefly be sharing with you some of the work we do within Triggerize or Tiko Africa. We are rebranding into Tiko Africa around reaching adolescents and young people with sexual and reproductive health. So we've had a lot from the morning session and just from the speakers here, just really painting the picture of the magnitude of the health outcomes amongst adolescents and young people. And so I'm providing a case study for Kenya, although as Triggerize we work in a number of other countries within the region. But just to highlight some of the maybe two critical ones is that in Kenya, we see teen pregnancies really being on the rise, but a big percentage of these are really unintended pregnancies. It means there's a lack of protective measures against these unintended pregnancies. We also see that amongst HIV infections, new HIV infections, a big percentage of them as well, more than 50% are occurring amongst young people aged 15 to 24 years. And when we look at generally health outcomes amongst young people, adolescents and young adults or young people, we don't see the same trend across. So those from poorer backgrounds are more disproportionately affected. And we find that when we look at the literature and really the challenges that young people face in access of health services, we see a lot of issues or barriers. So number one is the unaffordability of SRH products and services. So a lot of young people really do prefer, for example, in Kenya, to access health services or the sexual reproductive health services from private facilities. But a lot of the time, there's a cost element which they cannot afford. When they do access health services, a lot of the time we see the services being quite unfriendly or the quality of the counseling being quite poor. And most importantly, there's stigma and discrimination a lot of the time, particularly when it comes to access of family planning or contraception, perhaps because of pregnancy status of these adolescents and young people, but also when they identify as persons belonging to the LGBTQ community. So we see a lot of discrimination across all of these factors. And so even when they do access these services, we see a challenge because most of the time they will not adhere to the service, to their FP method, to their HIV treatment, to their PrEP medication. So therefore, because of this lack of agency, what does Tiko Africa do? Or rather, Triggerize our work. So just to say, we work across 5 countries in Sub-Saharan Africa region. So it's Kenya, Ethiopia, Uganda, South Africa, and Burkina Faso. And so we use a digital platform. This Tiko platform is a digital platform that connects young people to services. So it's a connector such that health providers become members of Tiko. And when young people sign up to Tiko, they're able to see the health providers engaging on Tiko and the various services that they're offering. And so they can select the service they're interested in based on their need. And so this makes it easy. But aside from connecting young people so that it's easy for them to access health providers, we also use other approaches to encourage them to really access services. So we use a combination of things. And we provide information or information related to the SRH products and services that they can find through Tiko. We use behavioral nudges to encourage them to access services. And we use an electronic voucher to help them really access services, make informed decisions about their lives. Now, these vouchers, critically, is that they help young people to access services without paying for it. So that cost element as a barrier gets reduced. Now, young people can sign up to Tiko in one of 3 ways. Number one, they can sign up, if they have a feature phone, they can send an SMS to Tiko, and Tiko can respond back, and there's a bit of back and forth process, and then they are members of Tiko. And from there on, they can access a service. They can also access or enroll onto Tiko with a smartphone, through WhatsApp, through Facebook, through Telegram. But the critical thing is that Tiko doesn't lock out any adolescent or young person who would like to access services just because they don't have access to a mobile phone. So Tiko allows young people to access services even without a mobile phone. So we use digital smart cards that young people can sign up. We work with community mobilizers on the ground that sign young people up to Tiko, and from there on they can access a service. And then when they want to come back for a refill, they just present the Tiko number and they can get a service. So the critical thing about Tiko as well, other than connecting young people to services, it also allows us to collect real-time data to understand who are we reaching, what service are they accessing, and so we are able to really do a lot of adaptive programming because of the real-time data that we collect on Tiko. So very quickly, some of the nudges we use and reward mechanism. The services are 100% subsidized. So young people can access an HIV test, they can access an ART medication, they can access their PrEP service, and they can access their family planning method without paying. And for those who sign up with a phone or a smart card or a smartphone, we are able to send them reminders when they are due for their refill of their ART medication or their injectable. So we remind them that you're almost due to go for a service. Can you plan and go to the facility? When they access services on Tiko as well, especially for those who have a phone, we allow them to rate the quality of those services. And when they rate, we reward them. We give them a small reward, which is equivalent to 50 cents of a dollar or less. And so this really just encourages them, number one, to provide feedback around the quality of services that are on there to help other young people, but also encourages them to come back later for a refill. And so what impact have we been able to generate? So in Kenya, just in Kenya alone, within 2 years, we've been able to reach more than 400,000 young people. And these 400,000 young people have been able to access 784,000 services related to HIV, family planning, through Tiko platform itself. We have quality assured providers on the platform, and because of some of the feedback that young people give, as well as other capacity strengthening approaches that we use, we are able really to strengthen the quality of services that providers engaging through Tiko are providing to young people. And you can see 68% of young people signing on to Tiko do not have a phone. So that actually means that what we do really kind of takes care of all of the young people in their diversity, whatever they are, whether they have a phone or not, and where they are hailed from, and the service they need. So in terms of the key takeaway for us is that just to give you just a snapshot of one of the dashboards that we built from our real-time data. We use a combination of things. So the nudges that we use and the real-time data that Tiko allows us to get enables us to do adaptive programming. And we are also able to nudge young people to access a service and to stay onto the service for healthier lives. Thank you.